Yeah, I am 14 days fresh into retirement, which is why I threw out all my suits the other day, so this is the best I had. It was very kind of Henry to say. I did meet Henry, it was probably 25 years ago when he started with a company called Sensitech. Well, you probably know who Sensitech is. And we've had a great relationship since then. 35 years at UPS, I've had my P&Ls, I've run global strategy, marketing. Of that 35 years, 18 have been in healthcare logistics, both in Europe, about 7 years there, and then the rest of North America. What I do or have done for UPS, three things. I run their global strategy for healthcare, I run their global marketing group for healthcare, and then I run their M&A acquisition and integration group. I am a strategy person. There are lots of great topics. I looked at the agenda. The agenda is awesome. There's lots of great tactical, innovative discussions to really get where rubber meets road. I'm not going to be that. I'm going to be a little bit more strategic. So I'm not going to be about, how fast you climb the ladder, but I'm going to show you where the ladder should be placed on the wall. A little bit different. And I will connect it to logistics, I promise. So what I'm going to do here is I'm going to actually talk about 4 stories here. First one, I want to talk a little bit about the shift of disease. And by the way, these 4 stories, I kid you not, will drive what companies are doing in their logistics strategies. I'm going to tell you that processed foods, pollution, and digital habits are driving our healthcare logistics strategies. I know it seems a little goofy, but you got to trust me on this. So shift in disease, I'm going to talk a little bit about that. I'm going to talk about pollution, climate change, and urbanization. I'm going to talk a little bit about the shrinking labor pool. And then I'm going to wrap it up with, and there's a lot of conversation around digitization of the supply chain. I'll finish there. So the first thing, I'm going to start from the beginning. Healthcare in its core form was really designed to eradicate disease and just make life more livable. So what I'm going to do is I'm going to start from the very beginning in order to tell this story right. The beginning of the 20th century, most people died by communicable diseases. Malaria, respiratory diseases, smallpox, diarrhea. I mean, can you imagine dying from diarrhea? Anyway. This was the big problem back then, but because of investments in hospital systems, sanitation, antibiotics, we've basically eradicated these diseases, and diseases have shifted to the chronic diseases. Cancers, cardiovascular diseases, respiratory diseases. As a matter of fact, in the US, over 55% of the population has at least one of these diseases, which is creating a whole new group of issues. Now, we need to get under the covers on this a little bit because the pace at which these diseases are growing is out of control. One of the largest drivers of disease growth is processed foods. This is pretty crazy. Processed foods, very few whole ingredients, a lot of artificial flavors and fillers. They're designed for convenience. They're prepackaged foods that have a very, very, very long shelf life. They're engineered to be perfectly sweet, perfectly salty, and even have the right texture to trigger the brain's reward system into overconsumption. I promise you I will get to logistics. I will. But what happens here is basically people are overeating these processed foods. Now, any guess what % of the average American's diet is processed foods? Throw something out there. Oh, man, almost right on. 62%. And that is so high that actually gives us the #1 spot in diabetes. 11% of our population suffers from diabetes. And it's not just diabetes, which I'll talk to about in a moment. Processed foods is a % of global sales. This is how crazy this world is right now. In the year 2000, 20% of global food sales are processed foods. In 2023, it is 50%. 50%. Now, just talked about the U.S. being #1 in terms of diabetes. It's not just diabetes. 31% higher risk in obesity. We've got a 34% higher risk in cardiovascular disease, and it is now being connected to a lot of the mental health issues that we have. All right, I'll start to bring this back a little bit. Really interesting graph that I use frequently. There's a tool out there called Gapminder. It is incredible. There's so much data out there, and you can put it in 4 different ways to look at how the data relates. So every circle on this graph is a country in the world. The size of the circle represents the population of that country. The most important statistic is the color of those countries. They are the grams of sugar consumed per person in each one of those countries. Blue and green, low. Obviously, yellow, orange, red, not so good, very high. Urbanization is this bottom. This is another important element. So it is the percent of that population that lives in an urban area. Why does that matter? There are a lot more processed foods. There's more air pollution. There's just more stuff in an urban area because it's more of a modern lifestyle. So that's urbanization. On the y-axis, it was the best health metric we could find. It's basically BMI, not a great one, but it is the ratio of weight to height. The data starts in 1980. So the first thing you're going to see is people moving from rural into urban areas. The second thing you're going to see is the colors of the countries change, and they are literally becoming darker, yellows, oranges, and reds. And in 1980, there was only a third of the world's countries that were above the BMI line. The BMI line here is anything over 23.5 is considered to be obese. Now we've got 2/3 of the countries considered to be, according to BMI measurement, obese. This stops at 2004. Who knows what the heck it is now. But I'm bringing this all together because this shift in disease, these are the fastest growing diseases. This means every manufacturing healthcare organization out there is driving to solve these diseases. Not every, most. And innovation in terms of what they're trying to get accomplished, this is where our healthcare industries are focused on. Now, when you look at the top 10 innovative categories that these companies are working on, I won't go through all of these, but biopharma innovation, mRNA vaccines, right? It was about 11 years ago, excuse me, 7% of the drug pipeline was a vaccine or biologic. Today, it is 65% of the drug pipeline. Cell and gene, CAR T therapy, super interesting stuff. They literally will take cells out of a cancer patient, bring them to a lab, re-engineer the cells, and put them back into a patient. That is needle-to-needle logistics. And I'll connect to the importance of logistics data in a minute. Here's the interesting thing, and this was referenced on the earlier slide. Of these 10 innovative categories, 7 of them require temperature control. 7 of them. So me as a logistics strategist, when I start to look forward, if I am not in this game with good competencies, I am losing out. Very important piece. So when we look at cold chain, cold chain is 40% the cold supply chain is 40% more expensive than traditional medicine supply chain. And the only way that comes down is through transparency, data, predictive analytics. Most of the effort with cold chain is literally reacting to when something didn't happen versus using all of the data out there in order to assess what could happen and to get ahead of it. The other piece I'll mention here, and I did mention cell and gene therapy. This cell and gene therapy is fairly small in the total scheme of things, but it will be the future of how a lot of these hard chronic diseases get solved. And this needle-to-needle logistics is going to require lots of attention. It will not be successful without very strong predictive analytics. Okay? So my second story is about urbanization. Okay, and what urbanization does. So about 68% of the world by 2030 will live in an urban area. Now, the WHO looks at the entire global population and suggests that 92% of people in the world are living in an area where there's unhealthy air climate. Okay, now when we think about this, you normally think about Delhi, India, perhaps, or Pakistan, Lahore, Pakistan, or maybe even Beijing, China. But this affects us in Europe and in the US as well. 1 in 3 in the US live in a county where there's unhealthy ozone level. Crazy statistic I found a few months ago is that more people die from air pollution than car accidents in the United States. Second, there is so much produced from our commercial processes with manufacturing, even plastics. We probably have heard a lot about microplastics in our water systems. Right now, each newborn is born with over 200 industrial chemicals in their system, okay? So it's costing us right now $820 billion in healthcare expenses, lost productivity, and quite frankly, just early mortality. Now, just to take you through a little bit of a cycle, and then I'll bring this one to logistics as well. Excuse me. When an urban area gets started, it's first, the forests have to be wiped out. Deforestation has to occur. 75% of new infectious diseases are the cause of this. Now we just had, and anyone see the movie Contagion? Like 2011, I know I'm completely going off script here, but so Contagion it became repopular during COVID, but at the end of the movie, you finally figure out what happened. Bulldozers come into the rainforest, wiping everything out, all the bugs, critters, and wildlife leave. The bats leave, they go to the nearest farm, they start living in the roof of the nearest farm, they poop into the pig food, the pigs eat the food, humans eat the pigs, voila, that was the premise of the movie. But I'm saying this because this has real implications to health. So when an urban area gets put up, diesel engines create soot. Soot is 1,500 times more effective at warming the atmosphere than carbon dioxide. As a matter of fact, as our ozone layers thin, temperatures go up about 1%, but when the ozone goes up about 1%, ground level temperatures go up about 8%. This is where you have increased asthma rates, respiratory illnesses, and autoimmune diseases. And then all of this carbon dioxide and soot technically does get reabsorbed into the ocean, only about 30%. Over 30%, the oceans become a little bit acidic, it disbalances marine life, and again, you have this cycle. This cycle is connected to health, and I'm going to connect it to logistics in a minute. The global cost of air pollution right now, globally, is about $5 trillion. Now, for us, in any manufactured process or logistics, this is another data opportunity, right? If you're dealing with any of, the S&P 500, any of these large organizations, they have teams that are really trying to create scientifically based targets for environmental sustainability. Some of them are working on social and economic sustainability, financial sustainability, but for the most part, if you're in logistics, there is not an RFP that comes in that does not ask, what the heck are you doing with science-based targets? And this is just going to continue to grow. So as a competency in terms of your data and what you're collecting and what you're asking for from your vendors, this becomes super important. Shrinking labor pool. Everyone knows everyone's getting older, right? The whole baby boomer thing, everyone's getting, I guess I'm part of that now, but everyone is getting a little bit older. But also the birth rate is not keeping up. So by 2050, there are going to be 9.8 billion people in the world. 3.1 of them will be over the age of 60. Who cares? The reason that's important is over the age of 60, you consume 3 times more healthcare than under the age of 60. That's significant. That shows you the forecast of what's going to happen with healthcare. Here's the other wrinkle, though. We've got an aging population leaving the workforce, but the birth rates are not keeping up. I'll use Europe as a great example. 1.5 children are being born per female, which is far short of the 2.1 you need. So the workforce is shrinking at about 20% over the course of the next 5 years. So I think the best example of this, and I'll connect this to logistics in a minute, I want to take Germany. So Germany back in the 1994 had 4 workers for every 1 retiree. Okay, now Germany, 74% of healthcare comes from the working population paying tax and paying social contributions. So they're supporting the healthcare system. 1994, 4 workers for every 1 retiree. The projection without immigration by 2060, 1.5 workers for every 1 retiree. So you can start to see this implication in terms of not just how healthcare is going to be afforded, but we're going to have this rising demand with new innovation, new services, new products in healthcare, and we're going to have this difficult piece in terms of the working population. Let me move to logistics on this, because immigration will fill some of this, but immigration or migration is not going to fill all of these gaps. They don't have the right skill sets. In logistics, excuse me, in the US we're going to have over 2 million worker shortage, and this is just versus 2020. In logistics, we tend to have a limited base of warehouse employees, transportation drivers. You're really starting to feel this over the last few years, which is why you see a lot of logistics companies now engaging in robotics and automation. We do surveys, UPS does surveys around the world constantly to keep the temperature of what's happening. In 2016, we usually go after senior level supply chain individuals, and we ask the question, how many of you are using or have a project funded to put in automation or robotics? So 2016 was 25% of respondents, 2023 was 80%. And it's becoming more important. And not only that, I think this was referenced in the big room, there was a conversation around AI, and AI now will also help us with that technical skills gap that we're talking about with the working population. Okay, finally, my last story. My last story is around technology adoption, and I'm going to date myself here, but when I first started working, I worked in a place where they had one computer for 30 people, and we all had our floppy disks. Did anyone go through this? Okay, thank you. So you literally had your floppy disks, and you'd stand in line, and you get to your computer, and you'd put it in, and literally you'd have your 30 minutes or whatever you had, and then you had to get in the back of the line. Today, like when I think about that, one computer for 30 people, today almost anyone over the age of 6 has a computer, and it's their cell phone. And that cell phone literally operates 1 million times faster than that computer we had. It's like comparing the speed of a bicycle to a rocket ship. So these young folks now have that rocket ship in their hand, which is absolutely amazing. I'm going to bring this into perspective here, and then I will connect this one to logistics as well. Every circle on this slide represents the month of an 18-year-old until the age of 90. Okay? So first thing, this individual will sleep for 288 months. They'll spend 126 months at school and work, 36 months eating and cooking, 36 months doing chores, 27 months grooming. I'm sure that's different between people, but in the end, they're going to have 334 months left in their life that are not occupied by these, required activities. Of this 334 months, 93% of it will be in front of a screen. Now, in front of a phone screen, a laptop, at the treadmill, right? They'll be in front of a screen. Now, what this means, and I know when you look at this, you get a little bit uneasy. It's like, can that really be? But here's what it means. At the end of the day, the generation now with phones in their hands are going to be so absolved into the digital world. What's about to happen and the innovation that will come out of this is going to be incredible. If that saying 10,000 hours makes you an expert, this 18-year-old will have over 250,000 hours in the digital world. And I think the best is still yet to come in terms of how this works. It took cell phones almost 16 years to reach 1 million users. It took ChatGPT 2 months. So the pace at which things are moving is incredible. Okay, let me get through this real quickly, because as digital hits healthcare, these are the biggest examples. I chose France because France historically tends to be a little bit behind. I'm allowed to say that because I am traditionally a French person. So France telemedicine consultations from 2019, 1% of consultations were telemedicine. Now it's up to 27%. Remote monitoring is becoming very, very big. And again, I took some countries that may not be known for their healthcare system, but Denmark. So Denmark put remote monitoring systems in homes of elderly patients with chronic diseases. And they've proven that they've reduced hospital admissions by 60%, mortality rates by 40%. This is just having those devices connected to a healthcare professional, and they can have a conversation before things get too crazy. Preventative. Okay, so I want to kind of wrap this section up because technology is finally getting to healthcare. The beauty about working at UPS is I'm dedicated to healthcare, but I also see what's happening in food and high tech, and I can see all of the different segments. And it's taken a while for healthcare to get there. So healthcare at home, the data that's required, what's going to happen is healthcare is moving into the home, but that's dialysis, drug infusion, right? And it's not just the delivery that goes to the home with the equipment. Information has to go to the nurses and the technicians in order to organize to say, okay, everything is there. I will show up now and set that patient up. So all of these things come together. You're going to see nurse aides and nurses just get phlebotomists get organized around this data set and the delivery. Diagnostics is another area that's getting a ton of play. I personally think when this happens, healthcare changes forever. Generally, you can draw about 50 microliters if you poke your thumb and you put it on a spot card. You can't get a full panel, can't get cholesterol and all that tested. But there are devices that can draw about 4,000 microliters, like this Tasso device, and there are more being invented. And once they get to 6,000 to 8,000 microliters, you can do a full panel. And when that happens, which I'm telling you we're just about 1.5 years away, when that happens, you will never have to go in. What will happen is I'm not feeling well on a telemedicine call. Okay, I'll order your test. Test gets ordered, goes to the lab reaches out for your physician. Physician does a telemedicine visit. Hey, guess what? You've got this, this, and this going on. Let's get you some medication instantly. Then they do the script electronically. So you can start to see where this will solve about 65% of healthcare issues just by getting a blood draw that's safe and doesn't hurt. Last but not least is AI. I could go on forever on this one in terms of the AI applications in diagnostics and within healthcare. For logistics, and this was referenced, I think, in the big room as well, logistics, there is so much great work being done right now in terms of optimizing inventory with transportation decisions, optimizing customers and saying, okay, look, in this warehouse, you're overstocking on all the products that you make money on. You're understocked. I'm sorry, reverse. You're overstocked on all of the products that you are that are very profitable, and you're understocked in the stuff. I can't get this right. You know what I'm saying. Flip it around. You have too much of the unprofitable stuff and not enough of the profitable stuff. But anyway, so AI is able to bring all this stuff together in a way that really will optimize and change logistics. And again, I'm not telling anyone in this room anything they don't know. But if I just wrap this up, for me, like I said, I'm worried about not how fast you can get up the ladder. I'm worried about if the ladder is on the right wall. Okay, and for me, these are the big indicators. These are the things that we know aren't going to change. When I look at our UPS healthcare strategy, all of our money goes into things that are around these areas. There is 2 more layers underneath this that we could go on forever, but I thought this might be a good way to hopefully set up, the rest of the logistics track today and at least make sure that we all have our ladders on the right wall. So. Anyway, I appreciate it. Thank you for your time.
All right, we'll open up the floor to any questions that people have. Anything?
See, my stuff is so vague. It's really tough to do.
I know.
And that's on purpose. That's on purpose.
I know. Okay.
Yeah.
All right. What? Oh, do we have? Oh.
So I'm curious to know, how do you come up with this kind of research where you tie a real world problem to logistics? Just wanted to think.
Yeah, I gotta say, so I've been focused on healthcare logistics for 22 years, maybe. I don't know. I think you just kind of see the themes. I will say that a lot of people, we talk a lot about the same trends, but we never just stop. Like we say, okay, cold chain is a growing component to what we're focused on. Well, does anyone ask why? Do you know what I mean? And like, what's driving it? And will it always be in front of us? I'm not sure I can answer that question very well. I mean, I am engaged with a lot of customers and PE firm. I do M&A stuff, so I am very engaged with a lot of the banks, and so I will confess I do learn a lot from some of their research. Yeah.
Any other questions?
All right.
All right.
Thank you. Appreciate it.
Okay. Thank you very much.